Sanchez is recognized.
Okay, my mic is working. Thank you, Mr. Chairman. And Madam Secretary, I want to thank you for taking the time to appear before the committee today to discuss the administration's fiscal year 2015 budget. I continue to believe that budgets are a reflection of what our priorities are in this country, and our priorities should be pretty clear. Creating an environment for good-paying jobs that allow workers to support a family, properly funding health care for all, and protecting benefits for those who have earned them. Those should be the focus. And I'm happy to see that the President's budget does reflect some of these goals. Specifically, just some things I wanted to point out. The proposed 2015 budget gets rid of a misguided approach to change the chain CPI balanced on the back of our seniors. It expands HIV/AIDS treatment and care through investments in the Ryan White HIV/AIDS program and CDC activities. It funds the National Institutes of Health at $30.2 billion and provides $140 million in services for victims of domestic violence. As one of the few women who sit on this committee, I think I would be remiss if I didn't spend at least a few moments on issues that are specific to women's health care. I want to talk about Title X. It's the only federal program exclusively dedicated to family planning and reproductive health services. Publicly funded family planning services have helped reduce the rates of unintended pregnancy and abortion in the United States. And in fact, the CDC has included family planning on its list of the top 10 most valuable public health achievements of the 20th century, along with things like childhood vaccinations and fluoridation of drinking water. I was pleased to see that the President's budget calls for a slight increase in Title X funding, and I was wondering, Madam Secretary, if you agree that the investment in family planning services is a valuable one that reduces government health care expenditures in the long run.
Well, I think it's been shown, Congresswoman, that family planning and having families be able to make choices about the timing of children and the timing of pregnancy is a huge health issue and a huge family security issue, and we've made some significant strides. I would also point out that as part of the Affordable Care Act, insurance policies now will cover a full range of health services for women, which was not necessarily the case. They will be not allowed to charge women more than men, which was typically a feature in the individual market, and for the first time have a focus on women's health issues, including family planning issues.
And do you think that the increased access to affordable birth control will affect health care costs overall under the Affordable Care Act?
Well, what we've seen, actuaries of private insurance companies will tell you that actually having contraception services as part of their package decreases costs because they pay for fewer unintended pregnancies and sometimes pregnancies that could result in very high birth and follow-up costs. So as an actuarial point of view, it is actually a net gain in terms of overall health costs. But more importantly, it allows families to make their own choices about families and timing, and the health of the mother and the health of the child are often significantly improved by that timing.
Thank you. Madam Secretary, and I yield back.
Thank you. Mr. Griffin.